Revolutionizing dental restoration, key insights on autotransplantation of third molars. Imagine a world where missing teeth can be replaced not with artificial implants, but with the patient's own natural teeth. This innovative approach, known as autotransplantation, is gaining traction in dental practices. Today, we will explore the key considerations for healthcare executives regarding the autotransplantation of third molars with completely formed roots. As we delve into the topic, we will uncover how this technique can enhance patient outcomes and reshape dental restoration practices. Autotransplantation involves relocating a tooth from one side in the mouth to another within the same patient. This method offers several advantages over traditional implants, including the preservation of natural teeth functions and the maintenance of alveolar bone volume. Research indicates that third molars are often suitable donor for replacing missing first or second molars, with success rate around 75% and survival rates of 91.1%. This technique presents a compelling alternative for dental restoration. Now that we understand the basics of autotransplantation, let's examine the critical factors that influence its success. Several factors significantly impact the success and survival of autotransplanted teeth. Notably, the use of donor teeth replica has been shown to enhance outcomes by protecting the donor teeth and promoting periodontal health. Additionally, the timing of root canal treatment is crucial. Initiate RCT too late can increase the risk of inflammatory root resorption (IRR). Furthermore, patient age plays a role, with individuals over 30 years old facing a higher risk of complications. With these factors in mind, let's discuss the implications of surgical techniques and timing on patient outcomes. The surgical procedure for autotransplantation requires meticulous planning and execution. Key techniques include the careful extraction of donor teeth and the use of cross-suture for stabilization. The timing of procedure is also critical. Immediate transplantation after teeth extraction yields better results than delayed procedures. Moreover, minimizing extra oral time, the duration the donor teeth is outside the mouth, is essential for preserving PDL vitality and reducing complications. As we consider the surgical aspects, it's important to address the potential complications that can arise during the procedure. Despite its advantages, autotransplantation is not without risks. The most common complication is IRR, which can occur when the PDL is damaged during extraction or surgery. Effective management strategies include using donor teeth replica and avoiding unnecessary apical resection and retrofitting. These practices can significantly reduce the incidence of IRR and improve overall success rate. Understanding these complications leads us to the importance of follow-up care and monitoring for long-term success. Postoperative care is vital for ensuring the long-term success of autotransplanted teeth. Regular follow-up appointments allowed for assessment of healing and identification of any complications early on. During these visits, clinicians should evaluate subjective symptoms, perform clinical assessments, and conduct radiographic examinations. This proactive approach not only enhances patient outcomes but also fosters trust and satisfaction in the treatment process. Finally, let's summarize the key takeaways and their implications for healthcare executives. In conclusion, the autotransplantation of third molars presents a promising alternative to traditional dental restoration methods. By understanding the key factors influencing success, implementing effective surgical techniques, managing complications, and prioritize follow-up care, healthcare workers can lead their organization toward innovative practice that enhance patient outcomes. As we move forward, embracing this technique could revolutionize the way we approach dental restoration, ultimately improving the quality of care for our patients. Thank you for joining us today, and let's continue to explore the future of dental health together.